Hello and welcome, everyone. This is Dr. Qamar Khan, and you're watching Coffee with Qamar from Citrus Health TV. Uh, I'm a board-certified nephrologist, Yale-trained, practicing in the United States. We are going to bring some guests every week for you, and we'll discuss some very interesting and unique perspective from those physicians. Today we have Dr. Javed Shahid, our guest, who is a neurosurgeon in the United States. So he and I share quite a few things in common. We have some things in common, and especially in the journey, the medical journey. We both are graduate from Dow Medical College. Uh, he was a gold medalist. I was not. He then came to United States in 1972, and he did his residency in New York, and I came to States in 1991, and I did my residency in New York also. Then he went to Connecticut and practiced neurosurgery there, and he was a section chief and um, did amazing things there, and was awarded with many prestigious awards, and one of them was Lindsay Excellence Award by Global Health Program, and he has been nominated the best neurosurgeon in Connecticut for many consecutive years. And I went to Connecticut for my fellowship at Yale, so I was there for 3 years. But then I moved to Midwest, and Dr. Shahid stayed in Connecticut in Norwalk and Danbury Hospital, where he was practicing. I used to go there for shopping. There's a very good Danbury Mall. So without any further ado, I will bring Dr. Shahid, and we'll start our very interesting discussion that we have planned for you. We are going to talk about future of medicine. Future anymore. It is actually present. So if I ask you, who is smarter, computers or humans? The answer is neither. It is the two together. Right answer. So that's where we are heading, and that's what we are going to talk about today. So Dr. Shahid, you're here with us. Thank you for joining us and giving us your valuable time. And we are very excited, and we had discussions before this program, and I would love to hear those ideas and your thoughts again.
Qamar, welcome. Thank you for inviting me and giving me this opportunity to talk. Because as an expat, I worked long. I've been 41 and a half years. I've been practicing neurosurgery. But I have always felt that how could I help Pakistan, because it's still dear to me. This is where my passion for neurosurgery started. I was influenced by a neurosurgeon in Karachi, which I thought was the greatest neurosurgeon, without MRIs, without CAT scanners, made the diagnosis, treated the people based on the neurology, and he was never wrong. So I learned from one of the best teachers, and that has paid for dividends in time immemorial in the last 41, 42 years of my practice here. But what I want to share is that we have technology now that we can sit here and talk to the budding medical students and young trainees in Pakistan, because I can go and spend some time in a certain institution. But I think the greater good is to utilize doing either webinars or having them join in conferences which we have, be participant of it, or we can talk about how to particularly talk about diseases or to treat. And I think that's the goal, is that we have now means that we can expand it. As Dr. Qamar was mentioning about my involvement at Global Health, Global health is something that mine's institution, which is called the Nuance Health, and with the University of Vermont, is an entity that tries to provide healthcare to third world, and I don't want to include China and Russia, but I went there also in two separate years to spend a week to 10 days to look at their health system and see what I can offer. So I learned that through this friendship of bringing people, and I've had neurosurgeons, surgeons from Vietnam, neurologists spend times with me in the office, sat through the whole day looking at how I analyze, how I treat patients, how do we discuss. And their end interview, which I did with all of them, was that they had a unique perspective of how medical care should be provided, because that's not what they are taught in China and Russia, how to interact and how important is a human being, and not just a piece of an MRI or a CAT scan, but it is how you interact with a human being. And I think that's the single most important thing. I learned something in China. I was asked to see a woman who was 42 years old, an maxillary surgeon, who wanted specific questions. She was diagnosed to have a spinal cord tumor. And so she asked me, do you do neuromonitoring? Because nobody in the city of 6 million people knew anything about neuromonitoring because they had no technologists to do that. And I said, yeah, we do that routinely for specific this kind of tumor. We can't dream of not using the technologies. The next question was, how much will it cost me to come to you in Danbury Hospital in Connecticut? I said, you don't need to come here. I gave the name in Beijing, one of the biggest in Shanghai, sorry, one of the biggest universities, who have published literature in peer-reviewed articles. And I said, go there. But nobody in that city ever thought to mention to them that she doesn't have to travel. And I said, it's 2.5 hours flight, and you will have the best care. You don't need to come here. So it's the question of how do we educate people? And education to me is dissipation of knowledge.
That's wonderful. So I also, as you know, that share this view that we were talking about it the other night, that we can really provide some good teaching to the medical students, postgraduate students, and doctors in Pakistan using the leverage of technology, and that is probably what will help these countries the most. And it could be that they may not have all the technology right now, but I guess we can prepare them, and we can deliver from the comfort of our home, and that is our strength right now, this era.
So, Qamar, let me tell you, in America, it's the philanthropy to the hospitals that allow to get them the latest technologies. It's very expensive technologies. I mean, you're talking $2 million, $3 million in neurosurgical equipment that are coming out now. But in order to provide the better care for the hospital, they go out to people who have money to donate that money. Pakistan has a great philanthropic organizations, and there are people who are willing to give. It's how you engage them and how you bring them into the healthcare to give that money for the cause. And I think that's something that probably has not been done on a wide basis. And I think that's the source of how you try to bring new technologies, educate the people, have the people to give the money. That will make a big difference.
Yeah, and I think we can find people, and as I have talked about this law of universal attraction. So if you really want to do something with all your heart, you will find people. They'll come along, and then they'll join you, and then you can achieve some amazing things. And those are not just by chance. And I think that we can really do something meaningful for Pakistan and even other under-resourced countries through education. So I think this is great. We probably also would like to talk about the telehealth, online health care that we can deliver, again, from here to any other country, including Pakistan. So tell us a little bit more about your telehealth experience.
So it is through WhatsApp. And it's amazing that through WhatsApp, and I have done the consultations for people in Dubai who had care there and they had questions, and this is through word of mouth they found out. And and same thing in Pakistan. I have my siblings are there, and they have friends who have complicated problems, so they want my opinion. So the MRI gets loaded. You can see the whole MRI. You can see the reports, and you can do a decent examination. The telehealth exams have really evolved a lot in the last 1 year because of the pandemic. I used it in my office practice from those time, and we still, for routine follow-up and question, we use the telehealth medicine. But I think that the importance of that is that people get comforted and they know they have a problem, they can contact you again. And they are willing to very uh, appreciative of your effort to help those people, because there are always doubts, and it's a human being. It's doubts in America, second opinion, third opinion. In Pakistan, it's probably even fourth opinion they go for it, so they can find somebody what they think makes sense for them.
Yes,
That's human
that's true.
nature. Yeah, but yes, so I have had, and when I have visited Pakistan, part of my visits are to appease my siblings, family, friends, or they know he's coming, so they want to wish to come and see me. But I think
Yes.
that telehealth helps that in a lot of ways. And I think the only question is that do we expand it through this with Suhail Choktai's effort, use that medium for the telehealth? What's happened is some limitation, but because it is not as clear, it's a small platform, but I think it can be transferred to a big screen to do that. And that's what I'm interested in doing also, because I will have time to do that.
Wonderful. So I want to just elaborate on this telehealth Medical City Online, Dr. Sohail Chokhtai's program, which is not just a video chat. It is much more than that, and it has medical record is incorporated and so many other things, and you can really with some limitation see patients in ways that you are seeing patients face to face. uh, I have done this in my practice during COVID. We completely stopped seeing patients face to face, and then we started the telehealth system, and it was an amazing experience. And patients started loving it because they didn't have to come to your office. They could connect to you from the comfort of their homes. And nowadays, most of the things are related to you make decisions. Yes, physical examination and history is very important. You can still do, as we talked yesterday, part of the examination and get pretty much the proper history. But then you can see all the, like, MRIs, CAT scans, labs, and everything through the telehealth system, and that is the strength. And there are no boundaries. We talked about the walls have fallen, and we just are in a world that has no boundaries. It's a global village. That's what it is. So we can really make a big difference at this uh, day and age, and can probably take the um, state of the art medicine to these countries. And we talked about this thing that we can see our patients through telehealth, but if we teach them and if we train them, then it would even go further, and will be able to provide better healthcare in those countries. And that's your and my passion are mutual. You know that I have this EMET talks where it's like a free online medical lectures, slide based, and I invite um, speakers, and they record their lectures, and it's a library that we are building and slowly building, and most of the DAW graduates are helping me with that project. So maybe you could be uh, my neurosurgeon of the EMED talks. So, and we will be doing webinars, and I have been involved in many other things, and we did some very good webinars, inviting the president of the International Society of Peritoneal Dialysis and my Yale professor, and there were like 125 nephrologists from Pakistan. So we can do similar things in neurosurgery also, and we can take you uh, to Pakistan free. No airline travel, no everything is going to be from your home. So that's I think the future. So anything else that you would like to add to this?
No, I
Uh,
think that what I've found through global health, that that kind of a relationship developing, I mean, through global health, we were involved with Latin America, Africa, Vietnam, China, Russia, and they really, so we had a conference in Danbury where all these people who were part of it, they came. So so they people from different parts of the world met together to understand what this means. And when you talk to them, they felt really that the improvement, especially with the fifth year, fourth year medical students going there, spending time learning about infectious diseases. Within America, they don't know the complications they feel and how to treat them.
right.
You don't have a blood available, what you do on those things. So that experience in a third world to bring it to a first world and to kind of make the difference is what is really amazing.
That's very very true, and it's a two-way street, and I think that we can learn things, and we have like cases in these under-resourced countries that we don't even see here. I mean, so
Yeah.
I think you can really make a difference. So I think that we will end our first part of the um, program, and it was a very interesting and enlightening discussion. And um, after a break, we'll come back again.